Sexuality is a very important consideration during pregnancy. There are no really hard and fast rules about do's and don'ts with regard to sexuality, but certain physical and emotional changes are very common. In pregnancy, the vaginal tissue has a significantly increased blood flow and then therefore becomes significantly more sensitive and engorged. This often leads to increased stimulation during intercourse and increased sexual pleasure and increased orgasm. Breast changes also occur in pregnancy with increased nipple sensitivity, which may lead to increased pleasure, but also can be associated sometimes with discomfort. As the woman's body changes during pregnancy, her feelings towards intercourse and her own sexuality may alter. Often during the middle trimester, the woman may feel more sexy because of the changes in her body. However, at the end of the pregnancy, she may feel less attractive sexually and physically, and this may also have an impact on sexual activity. For the father may be worried that intercourse may be harmful to his partner or to the baby. Again, this is very, very rare, and there are only certain situations where intercourse should be avoided, and I will come to that shortly. Sexual desire and sexual drive are often actually increased in pregnancy, and this is perfectly normal and can be a real plus. Also, during pregnancy, you don't have to worry about contraception, and this may mean that sexual interaction is easier and less stressful. Towards the end of the pregnancy, of course, the mother may become more tired and sexual activity may reduce in frequency. Sexual intercourse at the end of a pregnancy may become somewhat more problematic due to the increasing size of the mother's tummy and the physical restrictions imposed by the pregnancy. And the usual advice is for any couple to become creative. You may need to look at different sexual positions, for example, with the woman on top or lying at the side. And there are really no, again, do's or don'ts and no absolutes with regard to this. Whatever is comfortable for you and your partner is also safe and comfortable for the baby. Sexual intercourse by itself will not cause preterm labour. However, if the woman is predisposed to preterm labour, or if the cervix is already ripe for other reasons, then sexual intercourse may precipitate preterm labour. Women who are at risk of a preterm labour, as in women who have a previous history of premature delivery or women with a multiple pregnancy, probably should avoid intercourse due to the increased risk of prostaglandins released in the semen during intercourse, setting off the labour process. At term, of course, when the cervix is becoming ripe, sexual intercourse may bring forward the labour at the appropriate time. And we often advise women who have gone overdue if it is appropriate for them to try sexual intercourse in order for us to avoid inducing them. This again is completely safe for the mother and for the baby. The situations where sexual intercourse during pregnancy should be avoided are really in those women who are at a significantly increased risk of preterm labour. These are women who have had a previous preterm delivery or who have a multiple pregnancy. Another situation where sexual intercourse must be avoided is when the waters have already broken. If a woman is having recurrent vaginal bleeding during pregnancy, intercourse should be avoided. If a woman has a placenta previa during the 3rd trimester, or who has a placenta previa and has been having vaginal bleeding, again, sexual intercourse must be avoided. Often during pregnancy, after intercourse, some spotting or slight vaginal bleeding may be experienced. This is usually not of any concern, but as with any bleeding or spotting during pregnancy, we would always advise that medical advice from the doctor or midwife is sought. Please attend the maternity hospital if you have any concerns. Pregnancy is such an exciting and emotional time for couples, and sexuality is such an important part of a couple's identity. There is very little you can really do wrong during pregnancy in most situations, and communication between couples with regards to anxieties and concerns is very, very important. It is also important that if you have any queries or issues that you ask your midwife or your medical practitioner for advice or help on any of these subjects.